I'm Dr. Jeffrey Pasternak from Mayo Clinic, Rochester. I'm an assistant professor of anesthesiology and the chair of the Neurosurgical Anesthesia Division. I'm going to be discussing an article that will be published in the September 2011 issue of the Mayo Clinic Proceedings regarding patient consent for perioperative visual loss following major spine surgery. Visual loss is a rare but devastating complication following various types of surgery. Most commonly it's seen following major spine surgery or cardiac surgery. Patients at greatest risk following major spine surgery are those undergoing very prolonged procedures or procedures that are associated with substantial blood loss. Given that informed consent is a subjective process, our goal was to determine patient preferences and patient expectations regarding being consented or being forewarned of this devastating complication prior to undergoing major spine surgery. We wanted to determine whether patients prefer to hear about this complication from their surgeon or from their anesthesiologist. We also wanted to determine how patients prefer to hear about this complication, whether it was through a pamphlet or through a face-to-face discussion with their physician. And finally, we wanted to determine when was the most appropriate time to inform patients of this. Of the 437 patients surveyed, 184 responded, and of those who responded, 86% of patients thought that the most appropriate means to hear about this devastating complication was from their surgeon in a face-to-face discussion that occurred not on the day of their surgery. So this discussion would occur at a time prior to the morning of surgery. These findings relate to clinical practice in that risks, benefits, and alternatives play a major role in a patient's decision to undergo a major surgery. A discussion of rare complications which could have a major impact on patients' lives should be included in that discussion. Our study suggests that this discussion really shouldn't occur as a patient is being wheeled back to surgery by the anesthesiologist. Instead, the patient should have a chance to have a formal discussion with their surgeon and then have a chance to really think about this and weigh the risks and benefits and understand this complication prior to making the decision as to whether or not they want to undergo this major operation. The next steps are twofold. First, we would encourage physicians and scientists to study the devastating complication of visual loss following major spine surgery to better understand the pathophysiology, better understand the risk factors, and better understand how to predict which patients might be at higher risk than others. Secondly, I think it's important to get the message out to the medical community that patients really do prefer to have a frank discussion with their surgeon on the day prior to their operation.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.